So we have Violet Brown, and Violet is a certified health education specialist. She works for the Salt Lake County Health Department Lead Poisoning and Prevention Program. She has played a major role in developing and preparing for this conference and the MOC 4 Quality Improvement Project. So let's welcome Violet.
I am Violet Brown. I'm a public health educator with the Salt Lake County Health Department, and I know that today we have a lot of physicians in the room. And in our audience, we also have a lot of public health officials in the room. So I'd like to kind of just talk about what it is that brings us all together here today. So we know that physicians are the experts in individual patient care, and public health are the experts in population health. But populations are made out of individuals, and individuals grow into populations. So we really are interdependent on one another to really be successful in our goals, right, of creating healthy people and healthy communities. So one of the things that we are doing is trying to bridge that gap with this MOC Part 4 project that Dr. Fruin and Salt Lake County Health Department have come up with for pediatricians. So now let's move on to talking about this American Board of Pediatrics MOC Part 4 project. So for the pediatricians in the room, you know that this is a requirement to do an MOC Part 4 project every several years and get a certain number of credits. So we're trying to make this as easy as possible and again, bridge that public health and individual patient bridge the bridge. And so this is how we're going to do it. So Claudia has been wonderful in obtaining 25 credits for physicians who complete this project. What you will be required to do in your practice is test all 1- and 2-year-olds and then up to 72 months or 6 years if never tested before. You will report all point-of-care blood lead tests to the Utah Department of Health. Your venous, as Claudia had mentioned before, are all sent through the electronic lab reporting database, so you don't have to worry about those. But if you, we will be asking for reports about point-of-care tests being done. You'll refer families to the Salt Lake County Health Lead Safe Housing Program, and we'll provide you information about eligibility. They don't actually have to have an elevated blood lead level, and we'll have a speaker who is from that program to give you more information about that and help you set up the referral process. We would also like to see you referring eligible children to Baby Watch intervention for those who have elevated blood levels above 10. Then we would like to have you utilize the lead coalition guidance materials that Claudia pointed out in the folder, the questionnaire, the treatment guidelines, as well as some other materials that we've created for you and your patients. And then for data, you'll need to submit baseline and 2 quarterly data reports to the project leader, who is Claudia or I, depending on your jurisdiction. And we'll collect and analyze lead data with you on a monthly basis. So a pretty simple project. It could be done as fast as 6 months, or you could decide in your clinic to go a longer period of time to implement these things. One thing that we would really like to encourage you to do as a physician or as a practice is to implement point-of-care testing in your procedure. It is, if you don't already have something, it is an upfront cost, but it will increase the number of lead results that you're getting back dramatically. I have a 2-year-old. I've been learning about lead exposure. I have a wonderful mother-in-law and father-in-law who watch my daughter when I work, and they live in a house that was built in 1946. However, my University of Utah, my provider does not have a point-of-care testing machine anywhere, except for, so she would be referred to do a venous blood draw, and even with all of my knowledge, I'm so hesitant to do that for a screening procedure. And so if you are wanting to do these projects and really get engagement from your patients, you need to make it simple and a simple screening procedure to make it simple. The first step is simple, and then the second step, if you really need to, if they're screening a detectable level, you're getting that venous blood draw to confirm. But the great thing about point of care testing as well is that it's done in the office. It's done with a capillary or a heel prick, and the results take about 3 minutes to get. So before they leave, you will know whether or not they need to go for a venous, if you need to do patient education, all of those things. It's also, again, the least invasive way to screen and very acceptable to patients or to parents of your patients. It is effective as a screening tool, and it is CLIA waived. So there is only one CLIA waived blood lead analyzer on the market, which also makes it very simple for you to decide where to go. And your vendor, Henry Schein, or whoever you go through, they're going to already be set up with that vendor. And then as far as the reporting requirements go, I did already talk about this a little bit, but you will manually report all positive and negative point of care lead tests to the Utah Department of Health. In my discussions with pediatricians and family practitioners already, there is not a lot of knowledge that the rule has changed, that all blood lead levels have to be reported, whether they're a 0 or a 14. So that's very important for us to help you set up your policies and procedures and your workflows to do that. And then venous tests, I said, are being directly reported to the electronic lab reporting system. So if you're interested today, what do we want you to do? For getting credit, the things that you'll need to do are work with us up front to get things set up. We're happy to be as hands-on as you would like us to be, or if you want to have one leader in your practice do the coordination and just talk with us one-on-one, and then we'll do that. We'll have you submit your data. At the end of the project, you'll log on to the ABP website and complete an attestation form and send that to us, and then we will provide you credit. So what do we want from you today? We want you to learn a lot today, have a reason to get that motivation to do the work that it requires to do lead testing in your practice. Fill out the MOC Part 4 application in your packet. So along with the materials, the quiz, and all of that, behind that, there's an MOC Part 4 application that you can sign up. If you are a group of practitioners that want to do this all as a group, you'll assign a project leader, and they will be our main point of contact, but we'll work it with you as a whole group, or you can do it as an individual within your patient population. And then after that, once you submit that to us, either via email or you can drop it off at the registration desk today, we'll get contacted with you after the conference to get started. So Claudia Fruin and I are the main contacts on this project, and we hope that you'll join us to increase lead testing.